Good day, fellow learners. Once again, this is your mentor, your fact check buddy, joining you for another learning and teaching session. This time around, we're going to talk about case number 3. And without further ado, let's get the ball rolling. And I'd like to once again ask for your kind assistance to support the achievement or attainment of our goal, which is to provide free NCLEX RN application and review to 100 nurses. And to help us achieve this, just watch and finish the ads in our videos. Please don't skip. And thank you in advance for doing just that. So, on to our next generation NCLEX RN case number 3. Before we do so, let me share with you this success story. Hello, Sir Ray. I want to express my sincerest gratitude to you. I took my NCLEX exam last May 14. That's just a couple of days back, and got my result now, USRN na po. So she's now a USRN. Thank you, sir. Hindi po madali ang exam kung hindi dahil sa tulong nyo. So basically, she's saying the exam wasn't as easy as it had been without your help. Okay, so inspiring words, and most especially for the strategies and the trending tips, comprehensive review, TOP, core shell, quick fix, the things that you ask us to diagnose in terms of the case studies, and of course, the unlimited bootcamp. I passed. I'm so lucky because I'm from Baguio, and because I am from that place, it was easy for me to do the bootcamp before I go on my duty. As always, sir, as you always say, put a heart into what you're doing. Go slow in answering and think syndromic. Again, thank you very much, Ray Gapuz Review System team, and to my family who are always there to support me. God bless you always. So she actually said these words in a mixture of Filipino and English, so I just translated it real time. I just hope I did justice to what she wants to tell and inspire us with her own journey and experience. Okay, so let's move on. So on to our NCLEX RN alert. This time around, we're going to talk about the power of attorney for healthcare. So the power of attorney for healthcare is a document that enables a terminally ill client when they are no longer able to make medical decisions to empower or to authorize someone of their choice to make the necessary medical decisions on their behalf. So let's move on, and here's a functional concept. So a durable power of attorney for healthcare is a legal document that enables an individual to authorize another person to make decisions regarding their medical care. So when do we consider the durable power of attorney for healthcare as the basis for medical decision making? So here's another functional concept. When a client lacks decision-making capacity, the following persons are authorized to act as surrogate. 1, the healthcare agent, and the healthcare agent is supposed to be chosen by the client. So even if the spouse is still living, it does not necessarily mean that they are the decision maker. So the client has to specifically name their chosen healthcare agent who will make the decision on their behalf related to their medical care. Second would be the legal guardian, and then the next of kin, when we say next of kin, relatives in the following priority. So the spouse, the child, age 18 and above, the parent, the sibling, age 18 and above, the grandparent, and of course, the grandchild. And of course, number 4 on the list would be a close friend who is age 18 and above. Okay, so a durable power of attorney for healthcare becomes effective when the client is no longer able to make informed healthcare decisions as determined by the client's attending physician and is unable to communicate their wishes to healthcare providers. In other words, to make this simple, the durable power of attorney for healthcare becomes effective when the client becomes incapacitated, meaning they no longer possess the ability to make sound decision for themselves. Like, for example, if you have a client with hepatic encephalopathy in which the level of consciousness is decreasing, or when the client is suffering from severe cognitive deficits, as in the case of a client with Alzheimer's disease. So Here's case number 3. Let's apply our functional concepts and let's read through. An 80-year-old client is rendered incapacitated. That's the keyword that you need to look for when you think of the durable power of attorney for healthcare by Alzheimer's disease. So which means the keyword is there, incapacitated. Simply means that the client would not be able to make sound medical decisions. So the client's durable power of attorney for healthcare names her 63-year-old youngest sister as her healthcare agent. So the 63-year-old youngest sister is appointed as the healthcare agent. And if you would note on the succession of those who are supposed to be considered as decision makers for a client with the durable power of attorney for healthcare, the healthcare agent is number 1. However, here's a twist with this case. The client's 81-year-old husband is still alive and conversant. He stays at the client's bedside every day. So here is the client's husband who is still up and about and still conversant, and he stays with the client on a daily basis. Now, what do we do? So we have to stick it out with the concept that whoever is named as the decision maker of the client, meaning the client is appointed as the healthcare agent of the client, who executed the durable power of attorney for healthcare, then that person should be consulted for medical decision making. So here we go. Let's take a look at the question related to this case. The nurse should obtain an informed consent from which one of the following persons for an invasive procedure. So which simply means the client is incapacitated, the client cannot give informed consent. So who should the nurse take the consent from? In this case, you have the youngest sister as the duly appointed healthcare agent based on the client's durable power of attorney for healthcare. So therefore, is it 1, the client's husband, 2, the client's attending physician, 3, the client herself, or 4, the client's youngest sister? So the answer to this question would be the client's younger sister. Okay. The client's youngest sister, rather. Okay. So let me show you to you and inspire you with our endless list of passers from more than 30 countries worldwide. And the second requirement, if you want to pass NGN, is you have to learn how to navigate technology. And here at the Ray Gapuz system, we have our own tools published by world-renowned publishing companies. And of course, we have our own learning management system, which we call the Quick Fix Course Shells. And take note, the Quick Fix Course Shells, these are all included in our full bundle of learning tools. And of course, requirement number 3, you should be in a conducive environment to keep your focus. Here at the Ray Gapuz system, we have our own NCLEX simulation room, which you can use while doing the quick fix sessions. These sessions are done every month to reflect the trends in the test. So we also maintain our class size within the comfortable level in terms of the number of learners in a classroom. And of course, we have here a review from Princess Porcintula, who gave us 5 stars. Thank you very much. And she says, super warm. Well, not the environment, but the staff from maintenance, IT, admin, and mentors are very kind. They would treat you like a family. So thank you very much for the kind words from Princess. Our pleasure to have served you well, and we wish you good luck in your future endeavors. Okay. So I'd like to invite you to join us with our next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons. The fee starts at $3,499, and that includes the QBank, the use of 3 books. Okay, we're going to give you the books, of course, for free. The NGN strategies and sample questions from me, Dr. Ray, your mentor. And of course, you can attend live face-to-face or online, my quick fix sessions. So with that, thank you very much. And this is your mentor, your fact check buddy, Ray Gapuz. See you in our next learning and teaching session. Take care and have a good day.